Thank you very, very much for inviting me to speak today. I can't say how wonderful it is to have followed on from Dr. Arun, because I know him quite well, so that's very nice as well. And many of you may not know, but I was born in India, so it's part of my heart and my soul. And it would be lovely if we could all be there face to face rather than doing these webinars and Zooms and things, but it's better than nothing. And congratulations for the institution for their 20 years of physiotherapy education. That's fantastic. And I look forward to the next 20 years for you. So the topic today is around health promotion in practice. And we'll first of all look at some global health issues. And then we'll look at the WHO Health Promotion Charter and then think about how we put it into practice ourselves. So the background is through the World Health Organization data and around mortality and global burden of disease. So it's really important for us to understand why people die so that we can improve how people live. And measuring how many people die each year helps us to assess, if you like, the effectiveness of our health systems and direct resources to where they're most needed. So, for example, mortality data can help focus activities and resource allocation around many different sectors, including things like food and agriculture and transport, which are all really important for health. We also look at age standardized death rate. So again, it's really important to measure in the different age groups why people are dying, what diseases and injuries are affecting different groups in our societies. And that also helps us assess the effectiveness of a country's health system. And this helps authorities to determine whether they're focusing on the right kinds of public health actions that will reduce the number of preventable deaths and disease. And of course, we're very familiar with all of this over the last year with COVID-19. The next thing to understand is about disability and the thing called the DALY, or the Daily Disability Adjusted Life Year. So just talking about someone dying doesn't actually help us an awful lot, looking at the burden borne by individuals in different populations. So we use this measure that looks at the time-based measure that combines the years of life lost due to premature mortality. So let's say someone dies at the age of 40, and the years lost due to the time lived in states of less than full health, or the healthy life lost to disability. So that affects obviously person's income or their ability to provide food for their family or to be available to do things in society. So the DALY looks at the loss occurred by both mortality, but mostly important around disability. And so that's a really important one for us to be looking at. And it looks at, so the loss, the DALY, one DALY represents the loss of the equivalent of 1 year of health. And so we can look at the burden of diseases that cause premature death, but little disability. So someone who has measles or someone who drowns and dies, that really doesn't cause a lot of disability. But if we look at those things that don't cause death, like cataract is a very good one, or polio would be another one, these are what measure the DALY measures. And of course, in many countries, the two leading causes of disease burden are infectious diseases like lower respiratory infections and diarrheal diseases. But for us as physiotherapists, the next statement, 45% of the DALYs in many countries are caused by non-communicable diseases. And these are obviously areas where physiotherapy is central to interventions and rehabilitation. At a global level, 7 of the leading causes of death in 2019 were non-communicable diseases, and I've put those in red there. So you can see that these are going to be issues we'll talk about that are really important for physiotherapy intervention and for prevention and for health promotion. So again, disability rather than early death has become an increasingly large share of the global disease burden, rising from a fifth of the total burden in 1990 to more than a third in 2019. So that's saying that the non-communicable diseases causing disability have risen enormously. And it's in countries, many countries, more than half of all health loss, all the DALYs, is now due directly to NCDs and injuries, so the non-communicable diseases, including in countries like my own country. So these are hugely costly to individuals, to communities, and obviously to the country as a whole. Cardiovascular disease, as you'll all be aware, is a very high prevalence and is probably in most places the #1 cause of death. More people die annually from cardiovascular diseases than other diseases. Don't worry too much about the millions and things, but 30% of all global deaths were caused by cardiovascular diseases. And I mean, that's an enormous number of people, and some of it to the diseases and some due to stroke. And many of these obviously are preventable through lifestyle choices, which we're going to be talking about. Also attributable to high raised blood pressure and again strokes and the coronary heart disease. However, the leading cause of disability in 2017, and if we look at these, again, we see these are non-communicable diseases, and they're all areas in which physiotherapy plays an enormous role. Low back pain, headache, depression, diabetes, and that was interesting listening to Arun a minute ago, hearing loss through industrial work and things, COPD, through environmental things often, dietary deficiencies causing obesity, strokes, and things like road accidents. So again, I'll keep coming back to the fact that physiotherapy plays a big role in this, and how do we play it? And we'll look at that through health promotion. So just quickly through diabetes, you've just been hearing about that, and I was amazed to hear Arun talking about the diabetes in India going down and down in age groups, and I think this is happening everywhere, and that is purely through lifestyle changes, and that's a really big concern that we're looking at these changes in things like diabetes. And we know there are things that we can do to change these lifestyle activities that will improve type 2 diabetes. So that was interesting to hear that from Arun. Depression, in most countries now, mental health problems have become an increasing problem for everybody, and particularly in younger people. And I think over this last year with the COVID-19, it's affected enormously young people with their jobs, what will the future hold? And it's a big burden of disease because people are losing jobs, they're losing incomes, etc. Interestingly enough, the statistics say that women are affected by depression more than men. However, when we look at the worst depression and suicide, the statistics are high around men committing suicide. And again, we know there are effective treatments for depression. So these non-communicable diseases have got interventions, but we have to look at them. This was an earlier study, and it would be good for people to have a look at this and subsequent work by the Global Burden of Disease Group, talking about musculoskeletal diseases. And of course, that strikes at the heart of physiotherapy, I suppose. And in 2010, musculoskeletal diseases were the second greatest cause of disability in all regions of the world. Back pain, keeping people out of work, keeping people away from being able to do their sport or doing their social activities. An increase in osteoarthritis because of increasing obesity and changing lifestyles, really important issues. If we look at it has increased from an article in The Lancet between 1990 to 2010. It increased by 45% compared to 33% of average of all other disease areas. So that's huge. I mean, it's good for physio. It gives us lots of patients, obviously, but it's a terrible indictment on how we've been going about prevention, if you like. Osteoarthritis and, as I say, about obesity and lack of physical activity. And again, we know that there are effective interventions to be able to help prevent these things. And if you look at this current estimates of people, and this was 2012, so it's not as current, but look at the numbers. I mean, that is enormous numbers worldwide affected by back pain, neck pain, OA&E, and other musculoskeletal disorders. These are huge, and yet we know that there are good interventions that we can put in place. Road trauma, well, I don't need to talk about that in India and work in some of the other countries in the Southeast Asian areas, terrible death rates, but also injuries following the road trauma. And other trauma as well, of course, traffic, but also falls, work-related incidents, acts of violence, such as child abuse, youth violence, domestic violence, war and conflict. So trauma, again, causing both an increase in mortality, but also an increase in disability. So we need to change and have a think about what it is that we need to be looking at, and public health comes to the fore in this, and the social model of health. And I'm sure you're very aware of this, and we'll go through it fairly quickly. And again, COVID-19 has brought this to the front, thinking about public health issues that we've had to adopt and adapt because of COVID-19. So it talks of a conceptual framework within which improvements in health and well-being are achieved by directing effort towards addressing social, economic, and the environmental determinants of health. So the social determinants of health, if you like. It's based on the understanding that in order to get gains to occur, social, economic, and environmental determinants must be addressed rather than just disease and injury. So the medical model of looking at just disease and injury is not going to help us get better at health outcomes, if you like, if we don't look around at the things, the other aspects that surround our lives. And we need a community approach, obviously, from the government, down from your federal governments right down to local communities. And it has to come through things like education, through changes in policy and health promotion. And it's known generally as the biopsychosocial model. So looking at all the different factors that contribute to our health and well-being, the biological factors, the psychological factors, and the social factors. So WHO did a lot of work around this and developed what was known as the Ottawa Charter for Health Promotion. So the health promotion is defined as the process of enabling people to increase control over and to improve their own health. So people making decisions about their own health. Focuses on prevention rather than cure, and uses the disease as a starting point rather than the diseases themselves, and it's population focused. And there are three basic principles, if you like, of health promotion. The first one is enable. So health promotion aims to enable all people to achieve their fullest health by closing the gaps in health inequalities, by ensuring equal opportunities and resources for everyone, reducing differences in health status by ensuring equal opportunities to access resources to make effective health choices. So we know that in countries like India, with a large population and a lot of people in rural areas, there are a lot of health inequities, getting to a doctor, getting to see a physiotherapist. Any of these aspects can be really difficult. So health promotion is really about trying to close that gap. To mediate, so the responsibility of all of us, health professionals, health personnel, social groups, to negotiate between differing interests that perhaps aren't helping society to achieve health. So if I take, for example, the tobacco industry, there was a big program here in Australia about smoking and about plain packaging for cigarettes, so that the tobacco companies couldn't advertise about their product, if you like, on the outside of the tobacco, of the cigarette packet. And it was a very hard fought battle between the public health authorities here and the big tobacco companies, who of course felt that they would lose out by their advertising, etc. Fortunately, in Australia, the law was made that they couldn't put their advertising there. They had to be plain packaging, and this was accepted across in many different countries in the world. So again, there's a mediation, if you like, by health professionals. And the same's been done about reducing sugar in drinks that young people particularly have, but older people as well, because we know that it has a large effect on diabetes and obesity. And so we also, the third principle is around advocacy, supporting and making public health recommendations for health, getting the message out into the community, and that's something we'll talk about. In 2016, the WHO Global Health Promotion Conference was promoting health alongside the Sustainable Development Goals, and I hope people are familiar with them. I'll show you a slide in a moment. And they made this critical link between health for all and all for health. And that's what the Sustainable Development Goals do, highlighting the critical links between promoting health and a 2030 Agenda for Sustainable Development, which looks at a whole lot of issues, and we'll see those in a minute. And it established and developed the global principles and areas for health promotion, and gives a framework, if you like, through which governments throughout the world can use the transformational processes, if you like, of health promotion. So from that conference, they came up with these three pillars of health promotion. So good governance. So that's looking at things like government rules and regulations, how they look at good roads, good things like housing, etc., to enable a more sustainable society. And we know that if we have those things, that helps for health. Healthy cities, obviously, if I remember correctly, being in Delhi the year before last, the levels of pollution there are some of the worst in the world. And we know that that's a huge cause of problems for our healthy bodies. And health literacy, and that's a really important for one as physiotherapists, that's enabling people to understand more about health, understanding things about their body, understanding their illnesses so that they can make good decisions. So these are the sustainable goals, and I'll show you another picture of that in a moment. And this was their symbol, if you like, that came out from this conference about promoting health and promoting sustainable development. Health for all and all for health. Because when we look at the sustainable goals, these were developed by all the countries in the United Nations, about 160 countries, I think it is, and they followed on from the Millennium Development Goals. And every single one of these goals relate back to health, if you like. So if we look at no poverty, obviously people who are more impoverished have higher rates of illness, mortality and morbidity. If we look at let's say quality education, the more educated people become, we hope they have better understanding and can make better choices about health and healthy living. If we look at things around climate and things, so protecting our earth, protecting the waters, protecting the lands, really important around environmental issues. So you can see, and the peace and justice, well, we understand trauma that comes from peace, and justice where there are inequities in health. So every one of the Sustainable Development Goals, physiotherapists should be well familiar with, because they relate and interconnect everywhere to health. So you've got to understand how that became with health promotion and the Sustainable Development Goals being put together. And if we look at some of the things around our populations and our environments, with aging populations, political uncertainties, social structures changing, people moving into urban situations and our environments, we understand a bit more about the relationship, if you like, of the Sustainable Development Goals and into health promotion. And take, for example, pollution. It's a huge problem in our region. Rapid urbanisation, industrialisation, laws that aren't there in place, increasing number of vehicles. In fact, during COVID-19 here in Australia, it's been very good, and I'm sure in many countries you've noticed a change in the air quality when there haven't been the cars on the road. Indoor pollution, still in countries where wood's used for cooking inside, or coal and dung, and these cause so many deaths and things. We see this in many countries where the pollution is just horrendous. Pollution in the waters causing insanitation and things. And we know the health effects of pollution. Air pollution, water pollution, soil contamination affects every part of our bodies. And so linking, if you like, the Sustainable Development Goals with health promotion was such an important factor at that meeting in 2016. And out of that, they had another infographic that's come out that's really nice to look at, 12 tips to be healthy. And you can read those down. But again, every single one of these are things that we as physiotherapists need to be familiar with and promoting. And this is what health promotion is about, how we go about promoting these with our patients. And I'm going to talk about most of them as I go through the talk. And I think number 3 is particularly important at the moment, about vaccinations. And I think in India, you've been rolling out the vaccinations for COVID-19. Here in Australia and in some other countries, there are people who are worried about vaccinations or don't think they should be vaccinated. So again, how do we promote things like the safety of vaccinations? So as I said, health promotion is the process of enabling people to increase control of their own health and to improve their health. It fosters, if you like, good health and well-being. And it is about us telling about it, but it's also an action item as well. It's not just, some words that are put there and sounds good, but it's informing people of what they can do to stay healthy, so they take control of their own lives and not just be told, but they can take and do the things that they feel good about. To address the things in the community that influence health and well-being most, so that they can be supported. And as I say, it's about promoting health and preventing ill health, rather than focusing at people at risk for specific diseases. So it's all about promoting health and well-being, about prevention, rather than just treating diseases. So really, when we look at physiotherapy is about health promotion. That's what we do. Most of what we do is health promotion. We educate our patients, enabling to make control of their own lives. And so with the evidence that we've had more recently, not using so much passive things in our practice, such as electrotherapy and things, has changed, if you like, what we do in physiotherapy. And we'll look at some of these things. And so preventing these non-communicable diseases really looks at ongoing education screening. There needs to be access, obviously, for people to be able to make decisions. So we need a very strong primary healthcare sector, of which physiotherapy comes into the primary healthcare sector. And the communities must be engaged in taking care of their own health to change into a healthier lifestyle. So again, that's what we as physiotherapists can help do. And governments must give support, if you like, to the communities to do that delivery of services. So we're going to have a look at some of these issues for us as physiotherapists. Promoting physical activity. Well, I said this is what we do all the time. We teach exercises. We encourage people to be engaged in physical activity. We engage people who are not so able to engage in the disability, if you like, and not use disability as an excuse. But how can we enable someone who has spinal cord injuries or who has cerebral palsy? How can we engage them in physical activity? How can we, and particularly in India, where physical activity in older people has not been a cultural factor, how can we change their beliefs about activity and things? Because we know that increased levels of physical inactivity have negative impacts on health systems. How will we engage with if you like, the younger people who are very involved with online things, all the social media, et cetera, because we know there's increasing problems with people being physically inactive, and particularly younger children. And I think in India that there's an increasing problem of obesity in younger children through physical inactivity. So we know it has a huge part to play in improving health and through that economic benefits, helping prevent the chronic diseases, mental well-being. We know that there's good evidence about it, helping with mental health, social connections, networking, etc., increasing productivity, environment and play, and reducing traffic, etc. Healthy eating. Again, everybody should have access to good food. And I know that you've just been having the farmers have been staging campaigns in India about food and food deliveries and things. It's really important that government policies and things look at the safety of food, that it's nutritious and culturally appropriate. So we need to be educating our patients all the time regarding healthy eating habits. It's not hard. It's not something difficult. We can discuss issues with them. Can they access the food? Can we help them access it? Can we make sure that we talk about unhealthy foods? Here in Australia, a lot of people eat takeaway foods. One, they're expensive, and two, they're not necessarily very good in nutritional value. So helping children at school learn how to cook, understanding nutritional factors about food, vegetables, etc., how it's produced and how they shape our diets. So again, the advocacy for the transformation of a food system to make sure that everybody has access to good foods. Mental well-being, and here I've talked more about young people, and as I said, I think the COVID virus has been really tough on perhaps the 20 to 40-year-olds, because jobs have been lost, and where will they look to in the future, but also school children who haven't been able to go to school. And so how do we prepare to get them to be more resilient, if you like, and adapt to a world that this might happen more often? job security. There's more part-time jobs or casual jobs. Globalization has changed how jobs are in every country. Technology, as we know, has really changed how jobs are done. And the overexposure to the internet. So all these things have an effect, obviously, around regulating our emotions, having confidence, being able to problem solve, but also building up that resilience to be able to make decisions about how to lead their lives in better ways. Really important, because the incidence, as I said before, of mental health problems is one of the most rapidly rising non-communicable diseases in the world. Smoking, and I've been pleased the last few times I've been in India to see the decrease in smoking in India, but there are many people still smoking, and strategies need to be used, and we can certainly talk about those with our patients, make them aware of the effect of smoking on all parts of their bodies. I don't think people are really aware of how the smoke coming in, going through, it just doesn't affect the lungs at the heart, it affects every part of our body. And here in my home state in Victoria, it still costs, even though we've had a major reduction in smoking. But I suppose it's some of the older people who did keep on smoking. It costs 4,000 lives and about $5 billion each and every year. That's an enormous loss of lives, an enormous cost to the community. So tobacco smoking is an enormous problem. So we have, as I say, a key role to play, and make sure that we include these in our patient interactions as we're working with them. The activity, the healthy eating, effect of smoking and alcohol, mental health, sleep habits. We know that they also affect how we go about our lives. So as we take on these leadership and advocacy roles, we need to think about the equity of it. So we need to think about the notion that health equity is that everyone should have a full, have faith in that they're going to have the opportunity to get their full health potential, and that no one should be disadvantaged from achieving this potential if it can be avoided. Whereas health inequalities are differences in health status between population groups. So we know quite clearly that in poor rural areas, their health status is very unequal to those more affluent people living in some of the city areas. So health inequities, a difference in health status between population groups that are socially produced. They're systematic in their unequal distribution across the population. They're unavoidable and they're unfair. So our advocacy and leadership has to deal with these things. This is what we have to do as physiotherapists as well. It's not just left up to government officials. We have to talk to governments. We have to talk to policymakers. We need to talk to our local community leaders. We need to be involved to make sure that there is both health equity and equality of health. So it's an opportunity for us when we're looking at and thinking about health promotion to shift the way we think about physiotherapy. I was at a conference in Singapore once, and the first seminar they had was with a panel saying, should physiotherapists do health promotion? And I'm sitting there thinking, oh, this is a bit strange. And they said to me, Professor Jill, what do you think? And I said, well, I'm puzzled by the question, because to me, physiotherapy is 99% about health promotion. That's what we do every day in our practice, and we have to make sure that that's what we do. So we need to shift away, if you like, from just looking at the disease or the injury. Oh, they've got a sore knee, or they've got increased muscle tone, or they've got a broken femur, or they've got COPD. We need to stop thinking in that way, but look at the broad picture. Where do they live? What are their beliefs? What are their understandings of health? So we need to shift away from that medical model, if you like, of just looking at the disease or the injury and look at the social determinants of it, because we know that they are such enormous factors that are causing, if you like, the chronic diseases in particular and injuries. But we also know that human behaviour to make change in human behaviour is very complex. And those of you who have tried it yourselves even, you know, the New Year's resolution, I'm not going to eat this, or I'm not going to drink this, or I'm going to increase my physical activity. And after a couple of weeks, we've sort of forgotten about it. So it is complex, and the adoption of healthy behaviours, we have to look at a much broader approach, considering all these environmental factors affecting the people. We must be aware of the causes of morbidity and mortality and the role of interventions that we do to address the causes of bad health. So looking, as I say, at the big picture. So it'll involve us in discussions with our patients regarding healthy behaviours, providing education about connections between bad habits and poor health outcomes. So we need to become role models and looking at the behaviours, and should have confidence in addressing these broader health issues. Need to build partnerships, if you like, with other health professionals to provide communities with services based on the patient's needs, not just on what we think, but what is it that the patients believe they need. We need to educate the profession about the scope of physiotherapy in terms of health profession, because many physiotherapists don't think about it and don't use the word health promotion. And we need motivating and fostering people's ability to continue improving their health on their own is the best practice in physiotherapy. So I looked up some issues online from India, and I saw this statement from Oxfam and said India is facing the triple burden of diseases in an agenda of communicable diseases, non-communicable diseases, and emerging infectious diseases. So, you know, these are factors that India, as it grows and develops, these are still issues that are causing a lot of problems within your own country. I'm not going to read all through this, but I hope that you'll be able to access the talk later on. But the amount of money and I spent, the GDP, so the overall money in India spent on health is less than some of the smaller countries around about you. You need to advocate with the government about that. 70% of overall expenditure on health is on medicine. Now, we know that there are many other ways of dealing with health problems, if you like, other than using medicine. And we've seen the problems in the States, if you like, with the dependency on opioids, which has become just an epidemic there, which is terrible. We do know that there are the inequities that we were just talking about. We know that heart disease and stroke is one of the biggest killers of men and women in India. We know that there's a lot of poverty in India, and we know that poverty means that they're probably unable to afford good health, if you like, good health outcomes. And we know that there's the increasing problems of diabetes, heart attack, and some of these other words. So, you know, one in 4 Indians has a risk of dying from a non-communicable disease. This is what we've got to think about with health promotion. So these are statistics that you can look up and have a look at. These were just a few programs I saw that were looking at health promotion programs. I really liked the first one, which was looking at educating young people about equity, inclusion, gender equality, equity, and strategic partnerships with other sectors and stakeholders to enable adolescents to realise their full potential by making them responsible for decisions about their health and well-being by accessing knowledge and support that they need to be able to access that knowledge. We need to educate our young people because that's obviously the future of our countries. A national mental health program was put in place to ensure availability and accessibility. A national tobacco control program, and as I said, I have seen a change in smoking. An integrated child development service, looking at the health state of children from 0 to 6. It's good to have these programs, but we've got to make sure that we know about them and that we help implement these programs. It's no good the national government making these programs or people making them, and we as health professionals have an obligation to be involved and engaged with them. The National Health Policy, this came after 14 years, they reinvented it, if you like, and we're looking at the numbers of non-communicable and infectious diseases, the expenditure, the use of the private sector, capacity for people to be able to deal with things. So looking at providing healthcare in an assured manner, so a shift from sick care to wellness and well-being, a great promotion. You need to be aware of it. As physiotherapists, we must be aware of these policies. We must advocate for them in our communities. Another one that comes out, and I've given and this one is looking at smart cities, the government building smart cities that are environmentally better, that we know, as I said before, about pollution in the cities. So promoting health and well-being in the cities in the way that they are built, enabling better health outcomes. And then I thought this was a particularly important one, perhaps for you all to have a look at, our Integrated Health Promotion Manual on National Health Programs in India. And I've given you the website to go and have a look at this. And I thought it's a really good one to train you as physiotherapists, but also to train health workers in rural areas and things. And it has a number of different sections. It has, why it's there. It talks about communicating and counselling, because that's a very big area of trying to get behavioural change. It looks at the behavioural risk factors and the determinants of health, and it looks at the 12 risks. And they're the same ones that we've been looking at: healthy diet, physical activity, alcohol use, tobacco use, substance abuse, safe sex, road safety, personal hygiene, safe water and sanitation, vaccinations, and oral health. And that's something that we can talk about with all our patients, encouraging them to have a look at all these things. But we can be advocates as well. And this was something that came out from the American Physical Therapy Association, looking at what the individual physiotherapist can do on the left-hand side of your screen, what the associations can do in your country. There are many different physio associations and groups looking at communities and working in communities. And then there are what universities should be including in their university education programs for the undergraduates, for the graduate entry level or master's level or whatever level we're having of university graduates. So it's a really nice way of looking at, the shift from a biomedical paradigm to the biopsychosocial paradigm, which is what health promotion is all about. So build awareness of current public health priorities, engage in education of other health providers so they know about them and what our role is in them. And you can go down, discuss healthy behaviours with patients, create resources to educate physiotherapists and facilitate the integration of health promotion and wellness into practice. Gain knowledge and skills in health behaviour change and counselling, and that's a really good area that we need to educate ourselves in, because it's hard. Health change, behaviour changing health behaviours is really hard. Partnering with others to make sure that we do it alongside our other health professionals, and engaging in private and public community health promotion efforts. It's fundamental to physiotherapy that we engage in these activities. We should be key players in it because this is what we do, not just only one-on-one, but doing community projects as well as what we do with our individual patients. So as physiotherapists, we must enable people to take care of their own health and well-being through education. We should mediate on behalf of your patients and your communities to ensure they have access to appropriate drinks, food, etc. in their environments. And we must advocate for all people to have better health outcomes. We've got to get the message out. It doesn't matter whether it's to 2 people or whether it's to 10 people. We must take leadership and do these things. You can do it through your sporting groups. You can do it through your spiritual groups. You can do it through your family groups. You can do it through whatever groups you might be involved in, but get the message out. Run small programs. They're not difficult to do. Reach for the stars. Make a difference. We are at the heart of health promotion. We must make sure that we, as physiotherapists, look at the health and well-being holistically, not just at an individual level of the disease and the injury, but what is it that is causing these health problems for the individuals and for the communities, and what can we do as physiotherapists to make a change? So I would ask all of you to have a think about that in your practice, to think about how you can make just a little bit of change, because we know that if you drop one little pebble in a pond, it ripples out and makes changes everywhere. So thank you very, very much for inviting me to speak with you today. I hope that you think a lot about what I've said. I hope you have access to read it and then go and explore it a bit more yourself. And that health promotion, we think about physiotherapy and we just say to ourselves always that physiotherapy is fundamentally about health promotion. So thank you very, very much. It's wonderful to be with you all today.